Hello everyone, I'm Dr. Jacques Conradie from the Department of Neurosurgery at Kimberley Hospital in South Africa. Meningiomas are usually tough, fibrous and very vascular tumors. Ultrasonic aspirators are well known for use during meningioma surgery. However, surgeons experience great difficulty with the tougher and more vascular tumors, making them not amenable to an ultrasonic aspirator. Laser technology can also be used, but with its own set of advantages and disadvantages. This case series presents 5 patients who had meningioma resection with the assistance of radiofrequency ablation technology, or otherwise known as co-ablation. All 5 patients will not be discussed in depth due to time constraints, and only a summary will be given. The patients all had very large and clear meningiomas on preoperative brain CT and MRI, as can be seen on these images. They were taken for standard craniotomy and resection of the meningiomas. Due to the size and easy accessibility of these tumors, co-ablation was used instead of alternative instruments like the ultrasonic aspirator. This is an intraoperative video that demonstrates the co-ablator in action. As can be seen, it debulks and coagulates simultaneously to ensure continuous hemostasis. Additionally, it can also irrigate and aspirate simultaneously. Post-operative CTs were done on all patients and showed complete resection. All the patients recovered well and no operative complications were noted. Histological examination revealed WHO grade 1 tumors in all 5 cases. No recurrence has been seen on follow-up MRIs and no patient required radiation therapy. Complete surgical resection remains the standard treatment for meningiomas. As demonstrated by the classification system introduced by Simpson in 1957, the recurrence is determined by the extent of resection and intraoperative findings. This has led to the invention of different tools to aid in maximal resection, example the surgical microscope, laser, and the ultrasonic aspirator. Though laser has its advantages, it is not widely available, especially in Africa, is expensive, and requires trained personnel to operate. Ultrasonic aspirator has become very popular for meningioma surgery. Not only is it cheaper than laser and easier to use, but it can irrigate and aspirate simultaneously and has different models and settings which can be used for different meningiomas and approaches. Unfortunately, it is still less efficient with the harder, more fibrous meningiomas and does not have coagulation, meaning the surgeon will have to alternate between 2 instruments, which can make resection tedious. The first radiofrequency ablation one was introduced in 1998 and used for ENT surgery. Since then, it has been used in many disciplines and has been explained in general surgery and some neurosurgery cases. This image demonstrates its small size. The technology works by creating a plasma layer that can both decompose organic material and coagulate with very low thermal energy and damage. Different ones exist and can be altered for different surgical approaches. It has been described for endoscopic, endonasal, endocranial procedures as well. In our experience, resection was quicker, with much better hemostasis being maintained throughout. It irrigates and aspirates simultaneously, keeping the surgical field clear. There was no need to alternate between instruments, making resection smooth. An added benefit is that it is up to 10 times cheaper in South Africa than the ultrasonic aspirator. This is important in resource-constrained environments and places like Africa. Though further research is required, we believe the co-ablator to be an effective tool in the armamentarium of technology neurosurgeons can use to resect meningiomas, especially with the large, fibrous, and more vascular tumors. When compared to the ultrasonic aspirator, it seems to be cheaper, have shorter resection time, more convenient and effective with these fibrous and more vascular tumors.